I want you to meet Mrs. Mary Cooley, a midwife who lives in Albany, Georgia. She and thousands of other midwives all over the South have dedicated their lives to the birthing of healthy babies.
I'm gonna hold you close to my heart now, ain't that good news?
My name is Ginger Breedlove. I'm a nurse midwife who's been in a variety of practices over 40 years that has included clinical practice for 25 years in a birthing center and hospital environment, about 10 years starting the University of Kansas midwifery education program and teaching, and then the last few years as a consultant for nurse midwives around the country. We are experts in normal, in particular helping care for women through pregnancy, during labor and birth and postpartum. Some midwives, based on their educational pathway, do family planning, gynecology, and primary care through the lifespan. So the definition can be variable based on somebody's pathway. The affinity for midwives and doulas is growing, and part of that is women and their families wanting to be better supported, to be more engaged in decision making, to understand what consent means and how to be able to use their voice in a way that makes this experience that you don't do very many times in your life one that is as best possible what you want it to be. Midwives have had a history in our country that is rooted in immigration to the country. So we could start with really the indigenous Native Americans who practice traditional midwifery and to this day have many customs that have carried over for decades. And then when enslaved women and women from Ireland came over as midwives and key community leaders that were looked up to preserve the community and make sure families had healthy births, were gradually sort of cast aside and demoralized, degraded, and removed from the practice of maternity care by the 20s and 30s.
2 days ago, a baby delivered by a midwife died when it ought to have lived. As your health officer, it was my duty to find out why that baby died.
It transitioned into birth in the hospital, and as that transition happened, there definitely was a shift in the belief of where it was safe to give birth and who attended you for the safest birth. The marginalized black and brown enslaved midwives and the Irish midwives gradually became illegal in most communities, and the event and growth of the public health system began to emerge. So the first advent of I would say the more modern midwife that evolved in the 40s and 50s were predominantly white nurses. When we look at midwifery and racial divide, I can speak to the profession of midwifery from the association lens that I am a part of and was actually a past president of the American College of Nurse Midwives. ACNM actually formed in Kansas City in 1955, which is an interesting part of history. Prior to that, midwives were in two different organizations. There were the granny midwives and grand midwives and traditional midwives and indigenous midwives still practicing around the country. Many underground, many illegal, some legal. It depended on the states. But if you look at nurse midwifery, there was a distinction made as the civil rights movement really emerged about the black nurse midwife. And the disenfranchisement of those black midwives, nurse midwives, in the National Organization of White Midwives was definitely contentious. We find that in our history. I think it's really important that we acknowledge that those racial divides were present in our profession, and a need to talk about that. America is facing a maternal health crisis that probably was not recognized or growing recognition until about 2017.
Doctors and nurses have worked hard and successfully to reduce the U.S. infant mortality rate in recent decades. What's less known and less understood is the rise in maternal mortality, mothers dying after pregnancy or from childbirth-related causes.
Finally, there's been a wake-up call where the public and the policymakers are openly talking about this maternal health crisis. And what is the crisis? It's a disparity and inequity in health care based on that Black and brown maternal mortality, dying mothers, has been rising dramatically for the last 20 years. Black and brown women are more likely to die in childbirth than their counterparts. I think there are systems that are taking a serious look at this, and I know there are others who are taking no responsibility at all. It has to come from the federal level with funding. States don't have a lot of money in their budgets, but part of that funding needs to go to communities of color, where programs can be funded adequately and designed and led by those Black female leaders.
Daddy Adam, come on over here and put your name on your baby's birth certificate. What you gonna call him, Adam Jr.?
I reckon.